As the name says, Invisalign is invisible. It is absolutely clear. It's got a very small thickness, and you really cannot detect it.
The Invisalign process are a series of clear aligners. They're made from a set of impressions that you take of the patient. They custom make these for each person. It does straighten teeth, it creates new smiles, and it really works.
What we need to do first is we need to check and see if you're a candidate for Invisalign.
Once I decide that the patient is a good candidate, I show them some of my before-after cases that is very similar to their case.
We usually talk about, what it's going to take. Sometimes it's closing a space or resolving a little crowding or fixing an overjet or closing a bite.
So we kind of like an average of 20 hours a day. So you think you'll be able, as long as we have a dental clearance, we proceed and we do the impression.
Molds of the teeth give us the ability to then duplicate that person's dentition in 3 dimensions. And from there, we then create a plan of how we're going to move those teeth. And we were able to visualize it. We're able to plan with very, very precise, up to hundredths of a millimeter, what our final goal is going to be.
With this impression, when it goes to Invisalign, they put it in a special machine that takes a laser light, and the laser light digitizes all those particular points and then creates a computer image for that.
And a series of clear custom trays are made. And in quality control, because of the software and the innovative technology, fits like a glove.
Each tray has each minute movement programmed in, and because if they wear it for that prolonged period of time that they should wear it, your teeth do move into that position.
It's very thin, very clear, pretty comfortable. Every 2 weeks they get a new one.
With each new tray, it shows you what teeth are being moved. It's unbelievable.
Being able to visualize the progress really helps to create motivation. So when the patient can actually see that they have changed from where they started, and they can see it on the computer and they can say, oh, well, I've progressed, then it keeps them motivated, keeps them excited about getting to that end result.
With Invisalign, you get to see your smile changing and opening up as you're going along.
We can pretty much let them know at stage 10 or stage 7, you'll start to see that tooth moving in, or you'll start to see your gap getting smaller. We even have patients that plan their wedding depending on the ClinCheck stage.
So we simply pull up the computer screen, we walk her through, and she sees exactly on her wedding day how straight her teeth were going to be, which was far and above anything she could have imagined.
It's nice when they're able to include the orthodontics as part of their wedding planner.
It takes less time than braces because we're not really rearranging everything in the patient's mouth.
So with braces, when you put braces on all the teeth move in relationship to one another, whereas with Invisalign, you can just move 1 tooth, or you can move 2 or 3 teeth on the other side.
Patient compliance with Invisalign is very high because it's removable. They're not locked into it. They can brush and floss and eat normally.
You are able to remove them completely and floss between every single tooth and take everything off.
I really could not floss my teeth without severe discomfort and bleeding. And now I just floss every day, a couple times a day, and it's so wonderful.
Someone in the process that goes through either Invisalign or some type of orthodontics, that it changes the way that they feel about themselves every time they look in the mirror, every time they interact with people, and there is a whole physical posture change that occurs too, which is pretty awesome.
I'm the one with the biggest smile in the group. I stand out, and I everybody sees, I'm proud of it, I smile big, and I love it.
It's really something that will take you from one point where you're not happy to another point where you are happy. And I don't know if you can actually place a value on that.